A record today with 2,900 new coronavirus cases. As we get closer to having a vaccine, the state is coming up with a plan to distribute it. Health officials tell Channel 11's Liz Kilmer it will come in phases.
There's no telling exactly when we'll have a COVID-19 vaccine and no telling when life will return to normal once it's distributed. But today, the health secretary said they are working to get plans in place so that when we do have one, they can get it out as quickly and as safely as possible.
We, of course, do not have a date for when any of the vaccines will be available. We cannot set a specific date on science.
But when that day comes, when we have a safe and approved COVID-19 vaccine, state health officials say they'll be ready to roll it out.
When we get the ball, when we get the vaccines, we're going to have all of those distribution plans laid out.
The world is certainly watching as clinical trials continue, with 6 drug manufacturers working toward a safe, effective vaccine, which the FDA would need to get to the U.S. During a press briefing Thursday, State Health Secretary Dr. Rachel Levine said they anticipate Pfizer's vaccine could be the first, which requires ultra-cold storage. They're planning for that and other versions as well.
We're setting up all sorts of different contingency plans depending upon what they tell us.
Dr. Levine says vaccines won't be mandatory and won't be magical cures, but rather are expected to work like the flu vaccine. Distribution will occur in phases, with healthcare workers expected to get it first. From there, it will take quite some time before life feels like it did before the pandemic.
When people get the vaccine, they are still going to wear masks. They're still going to need to wash their hands and to use hand sanitizer. They still need to social distance and avoid large gatherings. But they will be much more protected and can have that comfort that they're much less likely to get the COVID-19 or to get a very severe case.
Now, meantime, today we also heard from the University of Pittsburgh. Their scientists say they're working on a promising treatment for COVID-19 involving a familiar woolly animal. I'll have that story for you coming up at 6. Back to you.